So, good day. I am Donnalyn A. Karinga from Bachelor of Science in Nursing Section C. So, for today's video, we are going to do a assessment of the heart and lungs. So, before we proceed to the assessment, we make sure that we do a hand washing procedure and check the doctor's order regarding the assessment that you are going to do. Then introduce yourself to the patient. So, ma'am, my name is Donnalyn A. Karingal, your student nurse for today. May I know your name?
I am Kisirin Barakyo,
Also, your birth date, ma'am?
January 29, 2003.
Okay po, thank you. So after that, we ask the patient. We ask this kind of question. So, ma'am, do you know where are you right now?
Yes po.
Okay, so that we ask this kind of question so that we may know if the patient is coherent or in the right state of mind. So, after that, explain to the patient the procedure kung paano ang gagawin natin. So, ma'am, what I am going to do, what I am going to assess your heart and lungs, which I will be using a stethoscope later to check your heartbeat if normal and your lung sounds. It is okay to you, ma'am?
Yes po.
Okay. Ma'am, do you experience chest pain before?
No po.
Are you having difficulty before?
Wala naman po.
Do you have asthma po, ma'am?
Wala po.
Okay po. In your family po, is there anyone who suffers from heart problems or hypertensions?
Wala naman din po.
How about po sa mother side niyo po?
Meron po.
Okay. Sa father side niyo po, is there anyone that suffers from heart problem or lung problem po?
Wala naman din po.
Okay po. Does your father smoke?
Yes po.
How many bucks per day po?
Parang 1 pack po.
Okay. So, how about do you smoke? How about you? Do you smoke?
Hindi po.
Okay, very good. So, after that, we wear our gloves. We wear our gloves, okay? Okay, so as you can see, I already worn my gloves. Then after that, check the chest of the patient and make sure in inspecting the chest of the patient, it is not barrel chested, which is indicative of emphysema or COPD. Before we are going to assess, we need to ask the permission of the patient if we can remove her gown. Ma'am, so we are going to the assessment na po. Is it okay with you po kung ibababa po natin yung gown natin para po ma-assess natin sila ng ayos?
Yes po.
Okay, thank you po, ma'am. Okay, so usually we only hear two sounds at the heart of the patient, which is lub and dub. Lub, dub, lub, dub. Lub is caused by the closure of the mitral and tricuspid anteroventricular valve or AV. And dub is caused by the closure of the aortic valve and pulmonary valve at the end of ventricular systole. So get the stethoscope to assess the heart and lungs of the patient. After we get the stethoscope, first is to use the diaphragm of the stethoscope, which is this. So first is assess the aortic valve of the patient that is located to the external border on the right side of the chest. So ito po. So, as you can see, dito po tayo. Yan, dito po. So, first is, it is found that the second intercostal space, i-assess po natin itong aortic valve. Ma'am, relax lang po. After that is the pulmonic valve. The loudest sound is the dog sound because it is the closing of the aortic valve. Then next is pulmonic valve. This is the second intercostal space on the left external border, which is ito po yung kanyang pulmonic valve. Ma'am, relax lang po ulit. Next is Erb's point between the pulmonic and tricuspid. Ma'am, relax lang po. Straight body po tayo, ma'am. Okay, ma'am. Thank you po. Move a little lower at the fourth intercostal space, which will the loud sound is the louder because it is the opening and the closing of our tricuspid and the mitral valve. Ito po yung fourth intercostal. Okay, straight po tayo, ma'am. Lastly is the apical pulse, which is found in the midclavicular line at the fifth intercostal space, which is the point of maximum impulse, and we should check it for at least 1 minute. Straight body po tayo ng konti. Saglit lang po. For at least 1 minute lang po, ma'am. There should be no swishing sound when we assess on the 5 points where we place our diaphragm. After using the diaphragm, we will now be using the bell part by assessing the same location, the aortic, pulmonic, Erb's point, tricuspid, and the apical. After the, so ito po yung bell part ng ating stethoscope. So, nauulitin lang po natin kung ano yung inassess nating part doon sa using our diaphragm. Then now we are using this bell part. The aortic. Earth's point. Tricuspid, which is the fourth intercostal space. Then the apical part, which is the fifth intercostal space, ma'am. Ayan, ano lang po tayo, straight body. Okay, ma'am. Thank you po. So, after the assessment of the heart, make sure to record the result or outcome, or if we heard any abnormal sounds from the heart of the patient. Okay, so now we are going to move on the assessing of the lungs. We are still going to use the diaphragm of the stethoscope, and afterwards the bell part. In assessing the lungs, we should start above the clavicle, which we can locate the apex of your lungs, which is dito po. Okay. Then we start from left side going to the right side. Do it a lateral way so that you can compare both sides of the lung. Then start at the apex, which is above the clavicle. Okay, ma'am. So mag-start na po ulit tayo. Okay. Inhale. Exhale. Inhale. Nasa kabila naman po. Inhale. Exhale. Next naman po is the second intercostal space. Then left and right to left. Inhale. Exhale. Kabila. Inhale. Exhale. Third intercostal space. Inhale. Exhale. Inhale. Exhale. Fourth intercostal space. Inhale. Exhale. Next. Inhale. Exhale. Ma'am, fifth intercostal space. Inhale. Exhale. Fifth intercostal. Inhale. Exhale. So the sixth intercostal space. Inhale. Exhale. Inhale. Exhale. And last is the lower lobes. Okay, ma'am. So inhale. Exhale. Inhale. Exhale. After that, we are going to use a bell part of the stethoscope. Then same procedure din po. Apex, inhale. Exhale. Inhale. Exhale. Second intercostal space. Inhale. Exhale. Inhale. Exhale. Third intercostal. Inhale. Exhale. Inhale. Exhale. Fourth intercostal. Inhale. Exhale. Inhale. Exhale. Fifth intercostal. Inhale. Exhale. Inhale. Exhale. Then sixth intercostal space. Inhale. Exhale. Okay, ma'am. Inhale. Exhale. And last is the lower lobes. Okay, ma'am. Inhale. po. As I assess the patient lungs, I can say that there is no lung problems or any abnormal sounds from the lungs of the patient. So after checking the dorsal part, we should also check the ventral part. So ask the patient to turn around. So ma'am, pwede po ba kayo mag-turn around to check your ventral part? So, since the lungs is being covered by the scapula and ventral part, we will assess the patient lungs along the spinal cord. Ito, of the patient, and we should ask the patient to bend his shoulder. Ma'am, can you bend your shoulder a little? So, mag-start tayo sa left side, going to the right side. Okay? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, ma'am. Inhale. Exhale. Third intercostal space. Inhale. Exhale. Inhale. Exhale. Fourth intercostal space. Inhale. Exhale. Inhale. Exhale. Fifth intercostal space. Inhale. Exhale. Okay. Inhale. Exhale. Okay, very good, ma'am. Sixth intercostal space. Inhale. Exhale. Inhale. Exhale. Mid-axillary part. So, dito po. Okay, ma. Okay. So, after that, after the diaphragm, use the bell. Dito po. No? Inhale. Exhale. Inhale. Exhale. Second intercostal space. Left. Inhale. Exhale. Inhale. Exhale. Third intercostal space. Inhale. Exhale. Inhale. Exhale. Fourth intercostal space. Inhale. Exhale. Inhale. Exhale. Fifth intercostal space. Inhale. Exhale. Inhale. Exhale. Ito, six. Sixth intercostal space. Inhale. Exhale. Inhale. Exhale. Seven dito. Seven intercostal space. Inhale. Exhale. Inhale. Exhale. The mid-axillary. Ito. No. Inhale. Exhale. Okay. Inhale. Exhale. After we assess the patient using our bell part, then we are going to ask the patient to wear her gown. Then after the assessing and recording the findings and result of the heart and lung of the patient, report it to the physician. So disinfect the stethoscope, discard the gloves and hand washing procedure.